Good morning and welcome to this week's Insight APSAT webinar. My name is James and I'm one of the clinical educators here at Insight, and it's my pleasure this morning to welcome you and also our generous guest presenter, Dr. Daniel Demant, who will introduce himself in a few moments' time. I'd like to begin by acknowledging the traditional owners of the land on which we're meeting today, and also to pay my respects to elders past, present and emerging, and also extend that respect to any Aboriginal and Torres Strait Islander people who are joining us in the room here today at Byalla in Brisbane, or who are out there in webinar land. So as you would know from the program, we have Dr. Demant today coming to us from New South Wales, but he was previously in Queensland, where this research in relation to the LGBT communities and substance use, and particularly the perceptions of young people and community stakeholders, was undertaken. And that really is going to be, I think, a good opportunity for us today, because I don't know if you're like me, where you've seen over the last 10 years since the National Drug Strategy House Health Survey has collected data specifically from LGBT people, that we're seeing these quite significantly higher prevalence rates of recent use of substances. So it's a great opportunity today to dig a little bit deeper into what's some of the context of that. So Dr. Daniel Demant is a lecturer in public health, currently with the University of Technology in Sydney. So I see you on the screen there. Let's hand over to you without further ado. Thank you.
Well, thank you very much and welcome. So as was just said, I'm going to talk a little bit about substance use within the LGBT community, and I'm trying to unpack that also a little bit in terms of perceptions. What I'm actually not going to do is to talk too much or take too much time in talking about individual rates of substance use. Obviously, I am going over that in a little bit of detail just for the context, but then it's really more about what actually are the reasons for that and what is actually the voices of young people who are at the highest risk of substance use within that community, and also generally what are they going to say and what actually is like the perception then of community stakeholders in there. I would also like to acknowledge that often when we do talk about LGBT health, we often seeing or perceiving the LGBT community or queer community as some sort of like monolith block of identity. That is not true. Each of the individual letters and each of the individual identities within the community have their own issues that are distinctly different from other people within the community. But we are going to have a look at what are some of the more shared experiences in there and how we can use them to contextualize substance use within that community. Just a little bit about myself. As was just said, I'm a senior lecturer in the School of Public Health at UTS, and I'm an epidemiologist. And I actually did live in Queensland for a while, and quite a bit of that research is based on when I did my research in Queensland, where I did my Master of Public Health as well as my PhD at the Queensland University of Technology in Kelvin Grove. That's also where I previously then worked as a researcher as well as in a teacher, and often did quite a lot of stuff around identity as well as substance use. When it comes to my research itself, it is about both substance use and sexual health in LGBT populations, and particularly the intersection in between the two of those ones. I'm not only research in that area, but also have some practical experiences. I was a public health officer for the German AIDS Council, and that might also answer your first question where the accent is coming from, but I also worked for other areas that are very close to it. I worked for the Queensland AIDS Council in 2011, and I also worked for the District Attorney's Office in Germany, where I had a look at sexually based offenses in there. Okay, now, the first thing I want to very briefly talk about is just really what actually is the evidence out there when it comes to disparities in substance use in Australia, and obviously also beyond, because when we have a look at that, it's often very difficult to get high quality data from a population that is very unknown in both sides, as well as how to actually reach them. And particularly when we talk about young people who may still come to terms with their own sexuality, it is often very difficult to actually get appropriate data from that population, because they may not necessarily identify, or at least not identify publicly, as being a part of the LGBT community, hence meaning that the data is not as high quality as it would be if we are having a look at other populations. And this is also one of the reasons I'm going to later talk about in a little bit more detail. Now, obviously, very early evidence is often very meaningless, but I still think that it's actually something that is really interesting, because we can see that this is nothing we found out like in the 90s or in the 80s, but something we found out more than 100 years ago. And there was a doctor in Germany, in Berlin. His name was Magnus Hirschfeld, or in the queer community was called Magnesia. And he actually was the first person to rigorously research substance use within sexual minority populations. And he particularly wrote a book which was just about everything he knew about sexual minority people. And in that book, there is one page where he talked about how he found out that lesbians in particular are apparently much more likely to smoke than heterosexual women, and he made it specifically when it comes to cigars. It's a bit of a bizarre thing, but it actually is the first time we know that from the research evidence, someone actually stating specifically that one LGBT population is more likely to use a substance than overall the heterosexual population. So, but what we generally know is, for example, when we talk about alcohol, it's not necessarily only about how much someone uses, but also about a lot of other factors as well. When we talk about sexual minority young people, we do know that they're not only drink more often, so as in terms of how many days they're drinking, they're also drinking riskier. So once they are drinking, they're more likely to binge drink, they're more likely to drink a high number of standard drinks. And it's also about the onset. So the onset of use is also at an earlier age than their sexual majority counterparts. And here, for example, when we have a look at past month use, this is in New York high school students. I use this study because this study is something that goes on for over 30 years now, looking at various different health outcomes in New York high school students, and the quality of the data is really impressive. And here you could see that actually past month use in New York high school students is significantly higher when we have a look at sexual minority people versus their sexual majority counterparts. The same is true from the same study, but here having a look at Pittsburgh high school students, when we actually have a look at binge drinking, where the percentage or incidence of binge drinking is twice that in lesbian and bisexual, here only females. And what we also know, and here this is quite interesting, here we are looking at the United States teenagers. So very young, early drinking in the United States is not as common as it is in other countries around the world, surprisingly. But here, when we actually have a look at what is the first time people have a full drink of alcohol, and here when before they're turning 15, we can also see that there is actually quite a dramatic difference between sexual minority people and straight young people. Then the second one, smoking. Here we also know that sexual minority people are more likely to smoke, more generally, and they're also more likely to start smoking at an earlier age than heterosexual counterparts. And interesting, what we also found out from various different studies now is that actually once they smoke, their chance of being dependent on it is actually much higher, and they have a higher level of dependency as well. And lastly, it's also when we have a look at illicit or illegal substances. Basically, we know that practically from every single substance that is out there from the studies, we know that sexual minority people use them more. That is not only for the most common ones, such as THC or MDMA, but it's also about the ones that are significantly less likely to occur overall when it, for example, comes to a crystal methamphetamine or GHB. One interesting one here is, for example, when we have a look at lifetime cannabis use among young people, that explains why the value is actually still fairly low. Here, again, almost double the number of when we have a look at their heterosexual counterparts. And this is something what I actually said very at the beginning. We really need to contextualize, and we really need to make sure that we are not looking at LGBT people as this some sort of like monolith form of monolith block of identities, because these disparities are actually really not equally distributed across all the different sexual minority subgroups or all the different subgroups within the LGBT community. Because from the studies we know, both from international as well as from Australian studies, is that, for example, bisexuals are more likely to use substances than their gay or lesbian counterparts. And we know that while LGBT women are still less likely to use than LGBT men, the disparities between heterosexuals and LGBT people are actually much larger in the female groups than they are in the male groups, which means that there is also some groups are at a higher risk of these disparities. And that is something where it's interesting. We can also have a look at what might actually be the reason for that. And this is what I want to look at now. So what actually is the reason for people using substances, or what is the reason for the disparities we can see here? For a very long time, we focused on just one thing, and we always assumed once we actually work on discrimination, marginalization, and oppression and similar things, that everything else will actually then be good. Now, we know that because the situation has improved so dramatically over the past couple of decades, and at the same time, we can see that actually the numbers of substance use, while they went better, the disparities are less and less likely to be there. It actually is not going down as fast as we hope or as fast as we assumed it is. So which then means that actually the reasons for these disparities we can see are multifaceted. It's not just one thing that can explain them. And that's why we need to make sure that we are contextualizing it broader. Generally, when it comes to the specific identities within the community, going beyond the marginalization and discrimination domain of using as a reason for that, but also to have a look at what actually are some of the more community or contextualized factors that are related to specific localized communities. But when we do have a look at what are some of the reasons, we know there are three main domains here. The first one, that's what I've just talked about. We were talking about discrimination, marginalization, oppression. We now know that it is also related to identity and the LGBT community itself. And we know that at least to some level, there's also targeted marketing. When we talk about discrimination, marginalization, and oppression, we know that LGBT people grow up in an environment that is usually perceived to be homonegative and heterosexist, where you have to constantly justify yourself and justify your own identity. That means there's some structural discrimination. That structural discrimination is getting less and less. We still have something when we talk about, for example, about religious schools within Australia, who are, despite being funded by the public purse and taxpayers, including gay tax money, are still being able to discriminate against LGBT young people. But other things that are perceived to be structural discrimination, such as not being able to get married, are things we actually worked on in the past couple of years, but it will take a while until we actually see the effects of that going through to the community. So this is one of the main reasons why we can see that it actually doesn't go down as fast as we were hoping, is because there is a bit of a lag of in between taking an action and it actually having an effect on the community. We know that there are extreme levels of physical and verbal violence, and that these are still pretty much at a very high level, despite going down over the past 2 decades or so. But we still know that roughly about 70 to 80% of LGBT people are going to experience some level of physical and verbal violence based on their sexual or gender identity in their life, and that this actually is higher, the rate is higher among young people than it is among older people. Then, particularly when we do talk about young people, it is also the rejection experience that comes here into terms. For example, when they are coming out and are starting to not only accepting their own sexual identity, but once actually starting to make sure other people are aware of it and coming out, that they are rejected by friends and families as well. And this is something that is really crucial, because we know that the perceived and actual level of discrimination and oppression is the highest when we talk about young people. And at the same time, we know that this is the phase where a lot of the mental, social, physical, and psychological development actually happens place. And at the same time, people make their first experiences with the use of alcohol, tobacco, and other substances. So it all comes down into like this one period of time, which exacerbates each other a little bit. But when we talk about community or identity, it is not as easy, because we know that there are a lot of marginalized and oppressed communities out there. So why do we see these disparities in substance use in some groups, such as LGBT people, but why don't we see it in other groups? For example, a lot of populations that are discriminated based on their race or the color of their skin. And here we are not seeing those same disparities in each of the groups. One idea here why people might see these disparities in some communities and others is potentially about the way we perceive identity and how different aspects of our identity work. Because we know that identity is not only about who you are, but it's also a journey about how you actually get to the self-awareness of who you are. And there are broadly different categories of identities. There are vertical and horizontal identities. And those vertical identities are those we usually share with a larger community that is part of our family. So often, for example, our ethnicity and religion is something we are socialized with at a very early age. We know that from our parents, we know what is a part of that culture. We are getting a few tricks and tips on how to handle marginalization, how to cope with all the stresses that are associated with those marginalized communities. But then we have those horizontal identities. Horizontal identities are identities that are usually or most commonly not shared with our parents or our immediate family. And that is sexual orientation, for example, or disability, which means that in this aspect, we actually are not socialized in these identities in the same way, and often have to find our own way to deal with these identities and to deal with all the issues that are coming with these identities, often at a much later stage than we would have when it comes to other ones, which also means that those coping strategies will also be available to us at a later stage as well. And when we talk about the LGBT community, this is when actually people are entering this community. Now, the LGBT community is something that is very multifaceted and takes place in various different contexts, from being a physical presence, but also being something that is increasingly online. But it still takes a very long time and also more self-awareness to be able to be part of those ones, to be part of this community. And once we are in this community, we know that the LGBT community is a source of socialization. It is a safe space. It offers us this support, but also it is something that is necessary as a general room where we can socialize with people who are like us and where people can find their potential partner. So these things on the LGBT community takes care of things that in other identities is being taken care of, the family or the general community. And here often at a very late stage, which then impacts on the way people are coping with all the effects that are related to it, and often because problems already arise before people were given the tools they need to actually cope and deal with stresses associated with the standing of a community within the culture. But when we do talk about the LGBT community, despite there being more and more manifestations of the community in the online space, we still know that a significant part of the community is related to a bar culture. So which means that the physical manifestation of the LGBT community is often perceived or is often factually be bars or other areas where there is a higher availability of alcohol and other drugs, which then obviously also leads to some sort of community culture and norms that leads to alcohol maybe being perceived as being something that is more acceptable than it might be in the general population, because it is constantly there. Now, obviously, there are also other physical manifestations of the LGBT community when it comes to community groups or, for example, AIDS councils or things like that. But when it comes to the way how people are socializing, the majority of that in the gay sense will happen or start at least in those premises where alcohol is always readily available, and where there is a culture of being more likely to drink alcohol and a higher availability of other substances, including illicit substances. Then there's also obviously targeted marketing. Now, targeted marketing is something that is very local, and some of the things that you can find internationally when it comes to targeted marketing are not available in Australia. For example, there is quite a lot of targeted marketing around tobacco and cigarettes, which is not the case in Australia due to the very generally strict laws around tobacco advertisement. But we do, for example, know that Philip Morris in the 90s had a specific strategy to ensure or to raise the prevalence of smoking within young LGBT people. And there was a plan that included such as giving out cigarettes, particularly around venues that are more likely to be frequented by sexual minority people, but also to have a higher density of outside advertising. Now, even though that is within Australia a very long time ago, there is still probably some of those effects you may still see nowadays. Because people don't just smoke and then stop smoking. It's a community norm. Purely a high prevalence of smoking can create a community norm by itself. And that is something that then can go down from a generation to the next generation through the socialization. Something that is still very common within Australia is a lot of targeted marketing when it comes to alcohol. And here you can see quite a lot of advertisement from Absolute Vodka, because they are probably more likely to advertise or have targeted marketing for sexual minority people than practically every other alcohol brand that is out there. And that also then creates, and here you can see it's not really just about the targeted marketing itself, but what targeted marketing does here is actually it creates a sense of community, and it uses the pictures and what is important to the community, like inside jokes. For example, when you have at the bottom right corner, in an absolute world, everything is 8 inches, and I'm leaving it up to you to identify what that actually means. But also on the other hand, on the other side, where you can see using actually people who are very famous within the community, and then creating or tapping into this sense of community to create something that actually connects their product, or here then more generally connects alcohol to being actually a part of the community. Now, those are the more general reasons we know from all the literature that is available out there. What actually is then really interesting is to see what actually happens in Queensland and Australia. What are some of the more contextualized areas? And here we did a couple of studies in the past couple of years, both qualitative and quantitative studies. And I want to concentrate on the qualitative studies, where we had a look, or when we talked to both LGBT or sexual minority young people about what is their perception, what do they think about substance use within the community, and then to have the same questions asked to stakeholders within the community. But we are not only talked about those ones, but we also actually basically confronted the stakeholders with what young people said, and also got like their opinion and idea of what they think actually is the problem. Obviously, we're not only talked about identifying what are the problems, what we can use here, but we also talked about what are some of the actual solutions we can find. So here, as I said, we had 2 groups of participants. We had group A, which is sexual minority young people. And here we limited the age from 18 to 35, and they had to live in Queensland. So now 18 to 35 is a bit of an odd age range. And I agree, because a lot of the time when we talk about young people, we are using the United Nations definition and saying up to the age of 24, 25, or the African definition, which says up to 30. But as I said previously, what we actually, like the basis of these definitions lies within socialization. And we understand that at some point socialization is at least not completely finished, but that we have a sufficient socialization to no longer be considered minority, to consider young people from a developmental perspective. Since that socialization happens at a later stage for sexual minority people, we increased that age range accordingly, using basically the same definition groundworks. In Group B, we then talked to LGBT community stakeholders, self-identified of any age, who are also from Queensland. When it comes to the recruitment, you use convenience sampling, often via social media, here particularly Facebook, and then snowballing and asking them to identify other young people or community stakeholders who might be interested in talking to us about it. And the whole thing started with a very minimally structured interview, and then we did a content basically just looking at what are some of the sort of like domains you can see that are consistent across at least a couple of those who were interviewed. In the Group A, we had a total of 31 interviews. They were somewhere between 30 minutes and 1 hour long, and the mean age was 24 years, somewhere between 18 and 34. Now, as you can see from the gender, we have quite a lot of people who are cisgendered females and males, and we only had 2 people who identify as trans or non-binary. That is one non-binary, one genderqueer. And also when we talk about sexual orientation, the vast majority of them identified as gay or lesbian, followed by bisexual, and then 2 people who identified as queer and 1 person who identified as pansexual. And here you can see one of the issues with actually doing research within a very diverse community. It is very difficult to actually get a sample that takes care or takes into account each of the individual parts of that community. And that also makes it very, very difficult to identify if there are any differences between the individual identities within the community. And that is something you will also see when we do talk about the results now. There were overall 2 very broad categories we talked about. The first one was the extent and acceptability of substance use within the community and the reasons for it, and then the reasons for disparities in substance use, because young people perceive those 2 domains to be very strongly correlated to each other by saying that the disparities in substance use can only be there if there is a stronger extent and acceptability of substance use within that particular community. In the category of extent and acceptability, there were 3 subcategories we talked about: the significance of substance use, the extent of substance use, and the acceptability of substance use. And now I'm going to go over these categories in a little bit more detail. There's always going to be a couple of quotes from some of the interviews. I'm not going to read them out loud, but we also have the PDF available. So if I may be going too fast over some of those slides, you can always just go back and read the quotes there in full. And there's also that is published as well, and the publication is open access, so you can actually have a look at that in more detail and also have a look at more quotes from young people in there. So now when we talk about the significance, young people perceived substance use to be a major problem within the community by what they actually have experienced and saw by themselves. However, they do think that sometimes substance use, when it was talked about in that particular community, that it actually was inflated by stereotyping and the stereotype of LGBT people, and particularly gay men who are constantly partying, and that this stereotype was then used and created or inflated a problem to a degree that actually is not there anymore. So overall, it was perceived to be a major problem, but it was not perceived to be a problem of that extent because it was seen to be inflated by stereotyping, at least to some degree. Overall, people actually did say that they would like to see a downturn in when it comes to substance use within the community, and they have perceived it to be not just a major problem, but also perceived it to be a major problem in comparison to the general population and in comparison to actually going to bars that are not identified as bars, frequently visited by LGBT people. And this is what they said when it comes to the extent that substance use of any kind is significantly more prevalent when it comes to the community, and not really just more prevalent when it comes to the community, but actually also so much more visible. So they said, we know there is so much more substance use because you can actually see it. And you can actually see it not just when it comes to the legal drugs such as alcohol or tobacco, but also when you actually look at those illegal drugs, that it is much more open in LGBT bars or clubs, that you can see people dealing with it, that you can see people handling substances, that you can see people using substances in there, and that the level of that is so much higher, or in a degree higher, that you actually can't see outside of the community to that extent. The reason for that is, or at least what young people said, is that they perceived that to be actually much more accepted within the general, within the LGBT community compared to the general community, and that this particularly is the case for hard drugs. One of the main reasons why people thought that is because they identified the LGBT community as a community that is extraordinarily liberal, and that this liberty comes with being afraid to guess or confront people about certain types of behavior. That LGBT people have been told, or are continue to be told, how to live their lives by a significant part of the population, and that they don't want to do the same thing to people within their own community, and that this created like some sort of barrier where it makes it difficult to talk about problems that are affecting the community, because people are afraid to be perceived as illiberal and being perceived to actually doing the exact same thing to their own community, people from outside the community doing to the community. And when it comes to the reasons for disparity, they are very similar to what I just briefly talked about previously. They talked about marginalization, they talked about discrimination, and also mental health. They talked about the LGBT culture and the lifestyle that they perceive is associated with being part of that community. They talked about the socio-political and ethical values of the community. And they talked about a couple of, or a range of other reasons, including media portraying and the demographic differences between the LGBT community and the general population. Because we already talked about that previously before, and I think this is sort of like very clear. They talked quite a lot about how they felt very different and how they felt isolated being part of a community they didn't really know much about, particularly at the beginning, which sort of like led to a lacking like a sense of belonging to a community and having the feeling that you are the only one, even though they knew they're not. They found so many issues actually finding a way into the community that they still had this lack of sense of belonging for a very long time. And also the experiences they themselves made being discriminated, particularly during while they were still going to school, and that a lot of them perceived that they had mental health issues and long-term issues that can be grounded into the discrimination they experienced when they were a little bit younger. Then obviously as part of them, also thankfully a smaller and smaller part, talked also about family and coming out problems, and then identifying substance use here again as a coping mechanism to those issues they faced or experienced with their own family and associated coming out problems. The LGBT culture and lifestyle, it is very clear and very similar to what we said before. The LGBT community is a bar culture, and it said particularly in Queensland, if at all. When we talked to LGBT young people from regional Queensland, they said that the LGBT community is factually non-existent in a lot of those communities. And I still remember that one. There was one interviewee from a smaller town in regional Queensland who said, here in my town, I am the LGBT community. So everything that I do is what the LGBT community thinks and does. They also said that overall in Australia, there's much more peer pressure to engage in binge drinking and high-risk drinking, and that this peer pressure, they perceive to be even stronger within the LGBT community, automatically making it difficult to go out and actually socialize in the community without being pressured into drinking more, but also more pressure into actually taking other substances. There were people who said they are not going out to queer venues anymore because they actually really can't resist this pressure. So they're protecting themselves by removing themselves from parts of the community, not the entire community, but from parts of the community. And then again said that actually makes socializing so much more difficult. Then we had the socio-political values. That is something I briefly talked about. It is that there is this liberty and acceptance as main community norms. What I talked about because of the experiences of other people telling them what to do, and now they don't want to do the same to other people within their identity. But they also said that there actually are a few norms and values and ethics and morals within the community that prevent or regulate substance use, and that the LGBT community is less bound to those ones. And that is particularly true for religious values, and that you can actually see that impact because that protective factor to a degree is actually not there anymore. Now, obviously, because it was a lot of people and everyone has their own individual opinions, they also mentioned a few other ones as well, and these are the ones that I found the most interesting one in there. They were not mentioned by too much, still there is some ground in there to actually talk about them. Some people say that the media normalizes substance use within the LGBT community, that every time you're actually getting excited that there is a new movie or a new TV show that looks or talks about the community, there's so much substance use in there, and that it sort of like normalizes it. Then some people talked about having a conflicting identity, identifying as religious and LGBT, or identifying as being part of a certain culture and being LGBT, and that alcohol for them was some way to actually cope with these conflicting identities, being confronted with homophobia for one part of their identity, and then with racism or Islamophobia for another part of their identity. And that is something really interesting. We tried to do a little study of that, but it's exceptionally difficult to actually find people because that is a very hard to reach community. They also said that it is about demographic differences, that family responsibilities such as having children also has an impact on the way you are engaging in substance use, that this is not the same case or to the same level for LGBT people, and that the LGBT community is overall a little bit younger than the general population, meaning they are also more likely to use substances than the general population, because we know that in the old age, at least, heavy binge drinking usually reduces a little bit. So, as a summary, young people, they were aware of those disparities within their community, and they overall perceived them to be accepted, and not only just that, but actually also normalized within their community. And they suggested a range of reasons for why they think those disparities are existing in the first place. So what we did is we asked the same questions to stakeholders, but we also had a look and analyzed this data before, and then talked to stakeholders about what they think about what young people talked about, and whether or not they can actually see that in the community, and how that developed over time. And they were able to tell us how that developed over time, because they were significantly older than those young people. Also, there's a little bit of an overlap when it comes to the oldest young person and the youngest stakeholder, but overall they were significantly older. Here you can also see how the community has developed over the years, because when it comes to gender, here we have a significant difference between almost exclusively male and having only 2 female stakeholders, and having no stakeholder. We're not able to find any stakeholder who was willing to talk to us who was non-binary. When it comes to how they identify as stakeholders, they work for LGBT organizations, for LGBT venues, or even both. And most of them had enormous experience within the community, with 8 of them being a stakeholder of the community for more than 10 years, and 5 for 5 to 10 years. So now, what do they think? It's like need to drink. When was, as before, They talked about the extent and acceptability of substance use and the reason for that. And then they talked about potential interventions on what we can do. They talked about politics and legislation. They talked about the role of NGOs and existing groups, the role of commercial LGBT venues, but also about the community as a whole. When it comes to the extent and acceptability, they largely agree with young people. They say that there is a problem in the community and that they actually don't see that declining. While they see that the general population, general substance use is getting lower and lower, despite certain hiccups when it comes, for example, to methamphetamine and every now and then. But overall, over time, it actually goes down. But they can't see the same decline for the LGBT community. And they perceive two substances of particular almost epidemic levels, and that is alcohol and crystal methamphetamine. They identified substance use actually even stronger than young people and say that substance use actually is a community norm. It is your ticket to be part of the community, to socialize within the community. And not only that, but actually is a badge of honor. Being able to use a lot of substances actually is something that is perceived to be more than just being accepted for it. And again, for the reasons for disparities, they really identify pretty much the same things young people identified as well. They said that despite things getting better, marginalization, discrimination, and mental health are still the most important factors. But when it comes to the LGBT cultural lifestyle, they agreed to it, and they said this actually is particularly important for young people because there's simply just nothing to do for them within the community. And particularly when you are in Queensland and you are outside of Sunshine Coast, Gold Coast, and Brisbane area, and maybe to like a certain degree also regional centers for Camp and Cairns. Otherwise, outside of those ones, there's factually nothing to do. And even in those centers, when everything turns around bars, that means that a lot of young people who are at the height of their socialization are excluded or factually excluded from them, despite being there one or two community organizations focusing on young people. They did not agree with the idea of liberty being a norm by itself, but they rather question whether that liberty actually is motivated or is grounded in limited knowledge about the effects of substance use, rather than actually being a real ethical norm. And they said that is because for a long period of time, general health services just didn't talk to us. And when they didn't talk to us, we are lacking the knowledge because we had to do everything by ourselves. And when you do everything by yourself, there is a higher likelihood of doing it in the wrong way. Then when it comes to interventions, and I do think at some point I'm going to run out of time, but I'm trying to get over with it. They talked about politics and legislation, noting that this was, or at least a part of the data collection was done when we were in the middle of the discussion about the so-called plebiscite on marriage equality. They talked about a lot when it comes to discrimination and marginalization, actually, and that we need more interventions that are aimed at that, that it is not enough to have it legislated in law, but that it actually needs to be something that actually is supporting and grounding it, that we need more publicly funded safe spaces for young LGBT people. And they say, for example, that even the police force has like their junior police clubs and everything that is publicly funded, and that we just need something similar for LGBT people, particularly outside of the metropolitan area that is Brisbane. And they need to change generally the legislation that are still available to ensure equality. Parts of that were related also to various other legislational pieces they identified that are or may be perceived to be discriminating against LGBT people. Then they talked about LGBT non-governmental organizations and the existing groups within that. They said there really needs to be just more activities done by them. Also, they acknowledged that there's just a lot of limitations to that when it comes to money, when it comes to time, staff, and volunteers who can do that, but that there also needs to be more advertising for existing activities. And that here, it actually needs to use social media. They said that a lot of the LGBT community is very old-fashioned when it comes to that, and they're using websites and mailing lists and newspapers and LGBT-specific newspapers that just do not reach a lot of young people, and that they need to learn more on how to use social media effectively and differently to what they're doing at the moment. And that when it comes to that, more social activities and less workshops on how to use condoms, less workshops on how to do that, but that actually social activities need to be the principle, and that health promotion can be integrated into them, but that this would be the way and how you can actually get young people to be more likely to be included and being willing to participate in these as well. They also talked about more generally mainstream services, making sure that they have everything in place to be more accepting and to also be safe places for LGBT people, acknowledging that there was a lot of change and that we as a community should actually not be something that is completely captured and separated from the mainstream community or the general community, but the LGBT people are a part of Queensland and are something where they can actually also socialize and normalize sexual minority identities through those mainstream services and them being a safe space for LGBT people. But they also acknowledge that actually a lot of that has already happened. Then they talked about commercial values and said that these are profit-driven, and that obviously because they are parts that make a lot of their profit with substance use, with alcohol use, that they are generally not interested in being in an alcohol-free environment or may not be interested in having alcohol-free events. So what here they said needs to be happen is that collaborations with NGOs are beneficial. And I do just remind you that a lot of the people who are stakeholders were actually people who are working and leading those venues as well. So when they are saying that LGBT commercial venues are not interested in that, they are saying they are not interested in it because they actually are needing to make money. So we have to have a look at how that works. Then they talked a lot about the community as a whole. And they said that over the past years, they perceived something to be like there is a growing lack of culture within the community, and that the community is only consisting of parties. While they acknowledged that that was pretty much the same thing 20 or 30 years ago, but that parties were different, that there was more community, but they were knowing each other, but also acknowledging that this might actually be related to the community just growing in size as well, making it different to have like the same tight-knitted sense of community as before. But also again here to actually break the isolation of the LGBT community and making sure that not everything you as an LGBT person is doing is something that is LGBT. Overall, as a summary, community stakeholders and young community members are very consistent in what they usually say, what they're saying, that substance use is an issue within the community and that there are a lot of reasons for that, and they agree to them, particularly when it comes to discrimination and of the community. Though when it comes to political liberty, there was a bit of an inconsistency in between the views. Although I have to say that actually there's quite a lot of research now on that actually identifies political liberty as one driver for substance use, but not for long-term substance use, but actually for more the likelihood that people are trying a substance out. They had a couple of ideas on how we intervene there. We talked just about from legislation over commercial, non-commercial venues and organizations and the community as a whole. Now, what we did then, and I said, concentrating on qualitative research, but there is also quantitative research. And we were trying to test that in the field by doing a cross-sectional survey among young people, and here looking at participation, connectedness to the LGBT community, and how that actually affected their substance use. We had a very large sample for considering the population and considering the size of Australia for almost 1,600 young people who are slightly younger in age than the interviewees. And here you can also see the breakdown by genders. We also here had a significantly higher presentation of sexual orientations other than LGBT, and also from genders other than men and women as well here, so which also made it a little bit easier to identify the data in a more comprehensive way. So now we had a look at connectedness and participation in the community. When we look at connectedness, so we identified on what their perception and relationship to the community is over various different variables, and used that then to create 3 equally sized groups of low, medium, and high connectedness to the community, and also here to participation. And then in the next step, we looked at how does that actually impact on substance use. Here you can see the 2 levels, above participation, below connectedness. You can see 2 models for each, before covariates and after covariates. After covariates means we take everything else into account and adjusted it for ethnicity, age, the place where they live, and so on. And here what you can see is the assist mean score. Assist is something that looks at how often people use various different types of substances, what their perception of those substances is, and also the level of dependency. And you can see that with the level of participation, the more likely they are to participate in the community, the more likely it is that they are having a very high level of substance use, which increases with every level of participation. When we look at connectedness, we can still see a difference, but actually is not the same. Here we can actually see that those who have a lower level of participation and a high level of participation are more likely to engage in substance use, whereas those with a moderate or medium level of connectedness to the community have a lower substance use. But as you can see, the difference in between the individual level, while statistically slightly almost significant here, not significant, it is very marginal. But this is, I still wanted to say that despite here not being significant, is because when we have a look at other research that came out in the last couple of years, they had the similar sort of like pattern, where people who have a very high connectedness to the community and a low connectedness to the community have higher levels of substance use than those with a moderate or medium level of connectedness. And what they identified or thought would be the reason for that is that people who are more likely to experience marginalization and discrimination may be more likely to feel very strongly connected to the community, but they're also at the same time more likely to use substances as a coping mechanism, so that it actually is not related to the connectedness to the community, but actually for the reason why they are connected to it. And whereas those who have a low level of connectedness are more likely not to identify or actually having issues accepting their own identity, and that is the reason why they are using substances as a coping mechanism, and at the same time the reason why they are less likely to feel connected to the community. Okay, so summary. We know that here from this community participation is associated significantly and meaningfully with substance use involvement. So there is a low to medium effect sizes, but they are still meaningful. And when we have a look at some subgroup analysis, I didn't put them on there because it would just be too much. We know that these differences and the effect sizes are higher for female groups and bisexual participants, but they're not significant for non-binary or other sexual minority identities, may also be relative size, and that it reduces once we take. When we look at community connectedness, there is the perception or idea that medium levels of connectedness may be something that can be perceived or is protective, but the evidence here is very little because it was not significant, because the sample size was, despite it being too large, was too small to detect these as being significant. But even if the differences would be significant, there's very little difference between them. So it would not be clinically really meaningful. And there are other reasons for why we can actually explain them, and that they may not be related to the community connectedness itself, but to the reason for why they are having that level of connectedness to the community. And with that, thank you very much for listening to me. And I am now happy to answer every and all questions you may have related to this particular topic. So thank you very much.
Daniel, thank you very much for going through all of that in such a comprehensive way. And I guess also, before we get into some of the questions, thank you for giving voice to this community, as widespread and many-layered as it is, as you've helped us to kind of, I guess, bring to our attention again, when it's easy sometimes to see things as a whole. So thank you for both of those things. And also thanks for hanging around to answer a few of the questions. We do have some that have come through, most definitely. I might even just begin with one of the ones that came through earlier on, but it probably links a little bit to that last component that you were talking about in some of that, that really kind of that broader research. Do we have any data about protective factors for LGBT people? So those who maybe aren't potentially using so much, is there anything about the support and the community that gives that protection that you've identified, or that you have any sort of ideas or theories around?
Yes, so I actually did another study which had a look worldwide on intersecting identities. So the idea, actually, what we always had when it comes to substance use is that people, the more likely they are experiencing discrimination, marginalization, the more likely they are going to use substances then as a coping mechanism. So the idea or perception behind that was, once you actually stack on multiple minority identities, that obviously the pressure or the need for a coping strategy as a result of that should actually also increase. Hence, it would be a reasonable hypothesis to say that people who are being part of multiple minority identities having more issues with substance use. But when we actually did that study, and that was a study where we had to look at 250,000 people, so not just a couple of them, and we had a lot of different variables from ethnicities up to the tiniest ethnic groups in Africa, and we found that actually that is not the case. So we found that ethnic minorities can actually be very protective. What we saw is that ethnic minorities were more likely to use substances. We know that sexual minorities were more likely to use substances, but people who identified as both at the same time were less likely to use substances than any of those groups individually. And that was very interesting. So there are protective factors, and identities work in complex ways. So we know that those are, and we are currently looking into doing a qualitative study on that to identify what actually might be the reason for that in particular. And we do know, for example, that we have generally female gender as a protective factor when it comes to substance use. We know that one, for example, doesn't work in the LGBT community because they may be less bound to the traditional norms and perceptions around gender and the role women are playing. So there are some protective factors, and there are some factors we don't, but we still don't know much about it. But when it comes to those identity factors, we do know that, and we know that people are volunteering, for example, for LGBT organizations. So people who have a different, stronger personal sense of connection to the community are less likely to use substances.
Oh, that's terrific. Well, thank you for that. And that may lead into, and I think you've answered some of possibly this question already contained in that kind of response then. There was a question around demographics on the research that you did here in Australia, or the research that you've sort of put together in Australia around in terms of demographics beyond, say, gender, age and sexuality. So was there anything that kind of picked up on, say, race, ethnicity, disability, those sorts of things? And the questioner was just looking at that around generalizability.
Mm-hmm. So I am not aware of any data that looks at this particular thing from the background of disability, and we didn't look at that data. We did look at data that was related to religion, and we had a look at it from how religious people are, how important religion is to them, if they are perceiving a conflict between their religious belief and their sexual orientation. And we also asked people who actually were a part of a religion but no longer identify them, whether or not the sexual orientation was related to the reason for that. And when we then had a look at those variables and substance use, we could see that people who identify with a religion but don't perceive it as something that is inconsistent with their sexual orientation have lower levels of substance use. Those who perceive them to be at odds with each other have higher levels of substance use. And we couldn't see any effect for people who are no longer part of a religion, because apparently if people are no longer identifying as a part of a religion, often them getting away from the religion happens much earlier than being fully aware of that, and apparently does no longer have a significant impact to those who have never been religious.
No, terrific. No, thank you for that. And I'm aware that we're coming up to time. We only have 2 more questions to put. So if anyone's able to stick around, hopefully you can. If not, if you have to go, thank you very much for logging in today. So just those questions, in that research, and particularly given that we had a Queensland population there, is there anything that stood out to you or was surprising or of note that was different for Queensland young people? I think you spoke about we're a very large state, so I'm sure that comes into it in terms of that we're very dispersed, but anything that that you found?
Well, they did talk quite a lot about the region differences between southeast Queensland and the rest of Queensland, and that effectively the LGBT or queer community is the Brisbane community, and that there's almost nothing outside of Brisbane, and that it makes it difficult for them to be or feel part of a community if that community is 500 or more kilometers away from where they actually are. So that was one of the issues. I would assume that to a degree that may also be the case for other states in Australia, maybe not to the same extent, but I would assume that this would be something that is unique to Australia rather than unique to Queensland in that sense. There were people who talked about Queensland being a more conservative or socially conservative state compared to other states, and where people say, well, Brisbane, despite being a big city, is very different to Sydney and Melbourne. So that was something in there. But to be quite honest, if we do have a look at the results of the marriage equality plebiscite, that may be a bit of a wrong perception, considering that agreement or the yes vote in Brisbane was higher than it was in Sydney.
Sure. Thanks for pulling those 2 factors together. That makes it very interesting. The other thing that you've done for me today is to be a little bit more suspicious about what I considered to be companies doing socially responsible advertising, that there may be a bit of an agenda behind that. But our final question, and I think this question probably answers itself in a way, but the LGBT community particularly has been very strong and well educated in areas of sexual health and well-being over the years, possibly because it's also affected those things, potentially had risks for the mainstream population. Do you think there's any learnings from that can be brought into how we also educate around substance use?
I think it's a lot about resilience, but I think when it actually comes to, because while we talk about sexual health, we're not really talking about sexual health, we're talking about HIV and AIDS. And everything else was related to that. And that was a problem that was happening in the 80s. And the consequences from HIV and AIDS, which are still in the heads of a lot of people, despite even those, for example, for me, who was born at the end of the 80s, it is still something that is in my head, is something that was travesty and to the community that goes beyond just something that affects people like COVID, but something that destroyed parts of the community. So the level of threat was just so much higher because it also was something that is visible. If you are using alcohol and you're binge drinking every day, it can still take years and for some people even decades to actually suffer the serious and severe consequence from that from a physical point of view. And those are often then removing themselves from public light. So it is not as public the problem, and it is still something because, you know, a little bit of HIV is not a thing, but being a little bit of drunk and being a little tipsy is a thing. So the level of threat, but also there is something that is acceptable in when it comes to substance use to a certain degree and a level, which is just not the case when it comes to HIV. I'm not saying that HIV is something that's unacceptable, but something as, there's no such thing as having a little bit of HIV.
No, that's a good point. Thank you for that. And our final questions that's just come through in the last few moments. And again, for anyone who needs to go, feel free to head off. Thank you for your attendance. Did your study and your research, and I know because particularly some of the qualitative side of things, identify any findings related to suicide prevention, at-risk substance use resulting in suicide and self-harm, or risk factors there? I know it wasn't what you were obviously looking at, but I guess it's an interesting question to ask.
So we do, like some of the young people, they talked about self-harm, often alongside substance use, something that is not related to substance use, but that is something that has the same purpose, such as coping, as a coping mechanism, or something to have a way out of the issues they're experiencing, but nothing that is related. I would assume that there is probably a connection between the two, but in that study, we didn't look at it. The only thing we did look in the quantitative study is general psychological distress and mental health, and we saw that those are related to substance use, which is the case in every community, and in most studies we can see out there. We did talk, also we had a look at a concept called minority stress, which takes into account self-harming and mental health from a perspective that is looking at it through the lens of the LGBT community. And we could see that being significantly associated with it. But it doesn't go into that much detail that we can talk about specific types of self-harm or suicide.